As a service to the community, St. Mary's Laboratory offers wellness blood profiles during the months of January, April, July, and October. The St. Mary's Wellness Blood Profile includes 29 different laboratory tests for just $25, plus 2 optional tests for an additional $5 each.
This is of tremendous value. This really makes a great blood screening program available to anyone regardless of insurance coverage or other ability to pay for lab services. It would be several $100s to do that on their own, and so I think it's a tremendous value that's being offered.
The 29 tests in the Wellness Blood Profile are generally grouped into 3 main categories: complete blood count, blood chemistries, and lipid profile. The complete blood count, or CBC, includes 9 different tests that calculate the cellular elements of a patient's blood.
So the physician would look at the complete blood count, and it would give them insights into things like the presence or absence of infection or inflammation, and the ability of the person to properly clot their blood. It would also give clues about anemia or blood loss. So there's a whole lot that goes into that test and that the physician can assess from the results of the CBC.
The blood chemistries category consists of 14 different tests that provide an overall picture of the patient's chemical balance, metabolism, and general health status.
The blood chemistry panel gives so much helpful information. It gives the fasting blood glucose level, which can describe a situation where someone is diabetic or pre-diabetic. It gives information regarding kidney function, liver function. It also gives electrolyte levels, which can be incredibly helpful to a treating physician. There's a wealth of information on this blood chemistry panel.
And the lipid profile category consists of 6 different tests that examine a group of fats and fat-like substances in the blood that are important components of cells and sources of energy.
The lipid profile would otherwise be known as a cholesterol panel, and this is of tremendous value because it helps us to identify cardiac risk. And so we've been watching cholesterol levels for years and years now. But now I think that we're coming at it with more sophistication in the interpretation than ever before. We're looking at how these cholesterol results mesh with other risk factors: blood pressure, age, gender, ethnicity, and how the collection of that data represents cardiac risk. And we're doing calculations based on that to make treatment strategies and plans that are specific to each patient.
Finally, the 2 optional tests for an additional $5 each are for hemoglobin A1C and thyroid-stimulating hormone.
The hemoglobin A1C is a 3-month measure of what a person's blood sugar has been doing. And so where the fasting glucose is 1 moment in time, the hemoglobin A1C is used for longer-term monitoring of diabetic treatment and the success of that. So the people that should have that monitored are diabetics, are recommended to have regular monitoring of that. Any other use really would be based on a discussion between the patient and their treating physician. Thyroid stimulating hormone is a measure of thyroid function, and this is something that's used routinely in people who may have an underactive thyroid and are taking replacement medication for that. It's used in the proper dosing and adjusting of the dosing of that medication. Beyond that use, it really should be a discussion between the patient and their treating physician of whether this would be an ideal diagnostic tool for their situation.
And now you can add an optional vitamin D test for an additional $15. Huntington resident Alvin Bowyer takes advantage of the St. Mary's Wellness Blood Profile 4 times each year. Whether you need to be checked that frequently depends on your health status and your doctor's recommendations, but Alvin says it gives him peace of mind.
I've reached an age that it's good to watch your blood levels, blood counts, and St. Mary's offers a real benefit to the community here. My doctor personally charges around $360 for this blood work. St. Mary's offers the same blood work for $35. What a wonderful benefit to the community.
The results of these tests are sent to both the patient and the patient's physician if requested. Dr. Allan recommends you include your physician so together you can address any health concerns identified.
I think it can be of tremendous help and value to have your treating physician look at these results with you, to interpret these, to make sure that things that look normal are normal, and to make sure that you're properly evaluating your health based on the results of these labs.
Wellness blood profiles may be purchased at St. Mary's Outpatient Center on the main campus or at St. Mary's Medical Campus Laboratory in Ironton, Ohio. No appointment is necessary, and the testing should be performed while fasting. For more information, call the St. Mary's Wellness Hotline at 304-526-6670.